Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Advantage Care Physicians Group to help you sort through what's going on with COVID-19 in our communities and all across the region, really all across the nation. We also want to hear from you. It's a call-in show. We want you to call in 516-393-1800. If it's busy, just keep calling. You'll get through. Governor Cuomo today says we are going to turn the valve on, reopening a little bit and then watch the dials. He says parts of the New York's economy could reopen by mid-May. That's starting with maybe construction and manufacturing. And Nassau Executive Laura Curran echoed those sentiments this afternoon, saying Nassau is within striking distance of starting the process of reopening. So here's where we are with the numbers as of today. The state, I mean, these are just horrible numbers, aren't they? 292,000, those are confirmed positive cases across the island. More than 68,000 infected with this deadly virus since the pandemic began. Now, while the governor says the death toll is still tragically high, he says it's on the decline, and the state had its lowest single-day toll from COVID-19. That was since March 30th. Statewide, the coronavirus has claimed upwards of 17,000 lives. Here in Long Island, more than 2,700 in Nassau and Suffolk have lost their lives. Just sink that in for a second. All right, let's get to the conversation. Joining us tonight, Dr. Nicole Thomas-Sealey, a family medicine specialist with Advantage Care Physicians. She will be speaking to us remotely as we all social distance. Doctor, let me first start by saying thank you to all of the first responders. You guys are really on the front lines, and you do need and you deserve our gratitude. So we thank you for everything that you're doing. Let me ask you, how are you holding up?
We're doing good, and thank you for having me this evening. Every day is a challenge, every day is a struggle, but we feel like we're getting stronger and stronger in the struggle, so we're doing pretty good right now.
And are you doing fine on PPE? I know you do a lot of telehealth with COVID-19 patients. Tell us about that, because that's really becoming very important, especially during this pandemic.
Absolutely. At Advantage Care Physicians of New York, we have understood very early on that we were going to have limitations to seeing our patients and that we would have to leverage technology very quickly. So through virtual visits and virtual health, we've been able to connect to our very vulnerable population and to those COVID-19 patients who've been exposed or have tested positive, and continue that communication with them and give them that guidance and care that they may need.
Okay, let's go to some of the questions right now. I think we're starting off with Kate. Is it Kate? Maria. We're going to start with Maria. Maria, what's your question tonight?
Okay, well, I just want to thank you for taking my call, and thank you to all the healthcare workers and the first responders for doing the great job that they've been doing. And I just want to say that I'm a grandmother of 6, and I have many friends with young children. I want to know about the COVID toe I heard about from a dermatologist, and I want to know, is it connected, or how is it connected to the COVID-19 and any known cases, and what age group does this affect?
Hi, Maria. Thank you for your question, and thank you for calling in and all your appreciation for frontline workers. So COVID-2 is sort of a new phenomenon that we're seeing with COVID-19. Initially, we would see with a lot of viruses, a lot of different things. Sometimes we heard about the loss of smell. Sometimes we heard about the loss of taste. And now we're hearing about the COVID-2. We don't really know exactly what's causing it, but the theory is that there's a level of inflammation within the body that is causing a sort of bruising or purpling color of the hands and sometimes the toes. And another theory is that there may be so much inflammation that it causes these very, very little tiny blood clots. But the good news is what we're seeing is that these are resolving on their own and not causing any major damage. So right now, the jury's still out, but that's what we're hearing right now about the COVID-2.
Yeah, and Doctor, you bring up a good point when you talk about the different symptoms. I was reading an article today in the medical magazine JAMA, which is apparently what I do now. My off time is read these medical articles. And the CDC has come out with different symptoms, chills, shakes. Have we ever seen, and they're even in this article they were talking about how it affects all of the organs in the body, potentially. Have we ever seen a virus that is just so odd and hard to pinpoint down?
Viruses are very funny, especially to Maria's point in the pediatric population. If you get a virus, you can break out into rashes, you can have different things within the mouth, with under the feet. And so they tend to have their own spectrum of what they're going to present with. We just never know. So COVID is just that new guy on the block. And so we'll just have to do a really good job of documenting how common these particular outbreaks are. If COVID-2 is specific to COVID-19, we just don't know that yet.
Yeah, okay. Everything's so new still. Let's go back to the phone lines. Kate, Kate, are you there?
Yeah.
What's your question tonight?
Good evening, doctor, and thank you for taking my call, and thank you for being on the front line. My husband tested positive again. Do the other household members have to quarantine again for another 14 days?
Hi, Kate. Thank you for your question. So, is my understanding that he tested positive initially and then tested again and was positive?
Yeah, said husband developed a second fever, tested positive again, and just asking about whether he should quarantine again.
Right. Okay. So generally, if you're exposed to a COVID-19 patient who has symptoms, so if that person has symptoms of fever, cough, shortness of breath, it's almost like you are resetting the clock for your own quarantining. As long as you're around a person who has symptoms, they could be shedding virus. And so that means you could also have that exposure. So you want to start from the beginning, start tracking yourself, start tracking your temperature twice a day, really monitoring your temperature and making sure of your own symptoms that you're not developing any new symptoms. So being very careful during this time on a second COVID positive test with second round of symptoms, you still want to make sure you're keeping a good track of yourself.
And we should also point out, Doctor, you can speak to this, even though you may have had it one time and you might have the antibodies, it doesn't mean you're immune to it. You could, we are seeing people that get this twice and multiple times.
So the immunity is the big question, and it's the one that we hope that once you're infected, that you don't get to be reinfected. We're really hoping that. But the research is just not out yet. We don't know, and so we can't make any heads or tails of it yet. In previous infections with viruses, you can develop that immunity, but you might not have it the following season. And so we don't know enough about COVID to know if that immunity is lifelong, short-term, 3 months. We're really in the dark about that right now.
Okay. Let's go back to the phones. Francis, are you there?
Yes.
What's your question tonight?
I am 87 years old, and I have been treated for lupus and arthritis, and I am taking hydrochloroquine for about a year.
Mm-hmm.
And I still get the virus.
That's a great question, Francis, and so thank you for that. So hydroxychloroquine initially had some promise in some very small studies, but as we look at it more, it really is utilized for those severe patients with moderate to severe symptoms, and not in the general population with mild symptoms. There's been no science to show that we should use that. But if you are on it for other reasons, like you mentioned, Francis, you should definitely continue that, because that treatment is for that process that you mentioned, which is lupus, and you would not want to have a lupus flare by stopping your hydroxychloroquine. So it doesn't protect you from COVID, but it keeps you safe by keeping your lupus under control.
And also, let me ask you this, follow up on that question. What do we know about remdesivir and famotidine? The
Right.
active ingredient in Pepcid for like heartburn? And there's some evidence that maybe that is helpful?
Good question. So the remdesivir is an antiviral medication used in some other viral diseases. And so again, the research is out there looking at that maybe it can stop the replication of the virus within your body. And so we don't know enough because there's not enough long-term research out there. But they're looking at that. There's no definitive to say that that's going to be a treatment. And then the famotidine is kind of the new kid on the block, something we're hearing on the news. And so it has a histamine effect where it reduces the body's response. And so one of the things that people are getting really sick from is the response to the COVID-19. That inflammatory process gets so high and so at a level that it gets uncontrollable. So the famotidine might have an effect there. But again, it's new. The study is very small. I think I read about 187 patients. So you can't base a recommendation on such a small study. But anything may have promise if followed for, long enough.
Yeah, we should point out that, you just made that perfect point. These are small studies that are happening in multiple locations, so we have to really wait till there's some kind of definitive answer and some agreement among all these studies, right?
Absolutely.
Yeah, okay. We're going to take a real quick break, and when we come back, we're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we do want to hear from you. It is a call-in show, so give us a call right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Nicole Thomas-Sealey, family medicine specialist with Advantage Care Physicians. Doctor, before the break, you were talking about early on about you do a lot of telehealth remotely because people are doing social distancing that may have COVID-19. Are you seeing any medications that people who are positive with COVID-19 should just stay away from, or is it still too early to even know that?
Well, at Advantage Care Physicians, one of the things we really take pride in is reconciling that medication list. So every time a patient calls in through that virtual visit, we pull up that list and we go through every single medication to make sure it matches that patient. So there's been a lot of talk about ACE inhibitors and anti-inflammatories like ibuprofen, and none of those have really panned out. So you just have to look at the patient and sort of customize which medications that they have and which medications that they should continue, especially if they have diabetes, coronary heart disease. There's medications that you want to be careful that they're not stopping during a COVID-19 infection.
Oh, that's a good point. Yeah, a lot of people will stop and get scared because they have COVID-19.
Right.
Back to the phone lines. Robert, are you there?
Yeah, hello.
Hello, what's your question tonight?
Yes, Stone. Thank you for taking the question. I work in the 9/11 field on an ambulance, and I was exposed with a positive COVID patient. And I went and got tested. It was negative. And my question is, where can I go to see if I have the antibodies without going through workers' comp and my private insurance?
Right. Thank you, Robert, for your question and your dedication at the 9/11 site. So the serology testing, there's a lot of FDA-approved serology testing, but where you're going to have that available will be limited because it's not widely available just yet. So if you call your primary care provider, they may not be able to provide that just yet. In certain communities, they're doing sero surveys, which is they'll go into communities and they randomly test patients for the antibody to see if they have it. And so we don't have a good answer for the serology testing yet, but we are hopeful that it will help us to identify patients that have been exposed. But then once we have that, we have to have guidelines to know what to do with those positive antibodies. So more to come on that, Robert. Just keep your ears open, and more guidelines will come out as the days evolve.
Yeah, it's hard to imagine. Some of us forget that it's only been really since the end of February that we started this.
Right.
It feels like it's been going on forever.
Yes.
Back to the phones. Susan, are you there?
Yes. Hi, doctor. Thank you for your service. So my question is about, so it's allergy season, and some people tend to sneeze a lot, and sometimes quite a few times in a row. When in a public place, is it proper to sneeze into the mask, which I happen to think wouldn't be so nice, or take it off and sneeze into the elbow?
Hi, Susan. Great question. I think allergies, my preference would be once you have that mask on your face, that is your barrier between any respiratory droplets and the outside public. So risking removing that mask, sneezing, and then allowing those respiratory droplets to let out by something you may not catch in your elbow, you want to avoid. So I would definitely keep the mask on. The beauty of the mask is if you have a cloth mask, which has been recommended, you can take that mask home and wash it. And so you want to make sure that once it's soiled or once it's wet, that that mask is washed for use again in the future.
Now, doctor, should you go home immediately after that, or is it okay to keep the mask after you've sneezed into the mask? Is it okay just to still walk around with that mask on?
I would definitely keep it on until you're able to safely be inside. I don't think your own sneeze is dangerous to you, but your sneeze can be dangerous to someone else. And so you want to keep it on until you're able to be safely in a home or in a location where you can use a tissue and discard it into a receptacle that can be removed.
Okay. Let's go to Blake on the line. Blake, are you there?
Yep.
What's your question, Knight?
Hi, I'm Blake from Lido Beach. Thanks for taking my call and for your service. I was curious if the mode of transmission of COVID-19 is the same from pets to humans as it is from humans to humans, and if there is any data on this topic. Thank you again, Dr.
Hi, Blake. You sound so adorable, like my daughter. So right now, there's no studies to show that your pets can transfer that to you as a human. The most common and what we've seen in all the cases here is that it's human to human transmission. And so that is really consistent so far. We have not found any pet to human transmission at this time.
Doctor, what do you say to parents who their kids have upcoming vaccinations or maintenance well-being checks? Should they just cancel those until this is over?
So that's a great question because vaccinations is so important. So I would say anyone who has children who are 24 months and under, okay, you have your newborns up to 24 months, those vaccinations are vital. I would say connect to your pediatrician through a virtual visit. Figure out what their plan is. At Advantage Care Physicians, we have set up times during the day where newborns will come in between 8:30 and 10 a.m. In a safe zone. No other pediatric patients are there, and those newborns are taken care of because those vaccinations are vital. Okay. So work with your pediatric provider to see what you should do.
Okay, that's all the time we have. Thank you so much, Dr. Nicole Thomas-Sealey, for everything you're doing on the front lines. We appreciate it. And thank you for watching this program and for your calls. We'll see you right here tomorrow night at 7. Stay safe. I'm Stone Grissom.